Good day, all. All breeders, pigeon breeders, are at risk of lung disease because of the bird poop, pigeons bird poop. The pollution is getting infected with the bird fancier's lung, also known as birds breeders lung disease. Thanks to the increased number of pigeons in the cities in the world, the pigeons are fed on many crossings of the road and are creating a menace throughout the cities of the world. A person is more likely to contact the disease if they feed birds or are exposed to their excreta, means their poop, at work or home due to repeated exposure to airborne avian antigens. Bird breeders lung disease is an immunologically medicated lung condition. The knowledge of this disease and diagnostic instruments, including the CT scan, pulmonary function testing machine, and bronchoscopic procedures, are diagnosing pigeons as a cause, according to specialists. Pigeon breeders disease is a lung condition also known as several other names like bird fancier disease, farmer lungs, etc. Medically, it is known as hypersensitivity pneumonia. HP is a type of interstitial lung disease that usually arises due to an exposure to an inhaled organic substance antigen. Some cases are due to exposure to certain kinds of bacteria, like in the case of farmer lung or fungus growing in the areas of water leakages into the wood or the walls. By far one of the most common cause of hypersensitivity pneumonia is exposure to bird droppings and feathers. This particular kind of hypersensitivity pneumonia is brought on by exposure of highly antigenic avian proteins exerted in bird droppings and waxy proteins covering a variety of birds' feathers bloom, which causes a hypersensitivity reaction in a susceptible host. Although being one of the most widespread varieties of hypersensitivity pneumonia, it frequently goes undiagnosed. Some of the symptoms include coughing, fits, and lung diseases include fever, coughing, shortness of breath due to repeated exposure to airborne avian antigens. Bird breeders lung disease is an immunologically mediated lung condition. Some of the symptoms include coughing fits, lung disease include fever, coughing, shortness of breath. I already told you. According to a study published in 2017 in Indian Pediatrics, the official journal of the Indian Academy of Pediatrics, children are more likely to contract pigeon breeders disease when they live near a backyard chicken or pigeon breeding operations. While breeding pigeons give the disease its name, pigeon breeders disease. Exposure to wild pigeons leading to diseases is not uncommon. In many cases, there is no exposure to pet birds or any other environmental cause except pigeons in the vicinity of their homes. It can lead to extremely serious incapacitating conditions like hypertension and pneumonia, which can result in interstitial lung disease or fibrotic lung disease. Doctors inquire especially about the patient's location and whether they keep birds at home if they are bird watchers. There are several patients with a diagnosis of hypersensitivity pneumonia who are living in the areas with a high density of pigeons. Hypersensitivity pneumonia can be treated by removing the offending agent. There is a large section of patients where the diseases will progress, necessitating long-term treatment, and it may lead to lung fibrosis, making the patient oxygen dependent. In such cases, they either face imminent death or must undergo a lung transplant. The problem of stopping wild pigeons exposure becomes a challenge and the disease may go on to become progressive. Installing bird nets at home and regular cleaning of bird droppings can prevent some exposure. Therefore, controlling the pigeon population and breeding is a must tackle to tackle these diseases. So if you are keeping a bird, whichever bird you are keeping, so their bird droppings and their feathers are risk for your health. So take care of your health. It can cause death also. So severe this disease is. So take care of yourself. Thanks for watching. Please subscribe, share with your family and friends. Good day all.